This is Pukeology Podcast, where science meets your hilarious puke stories and the tips and tricks to stop that chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. Pukeology.
Congratulations, ladies, you're pregnant. So do you want to know what each trimester has in store? Or maybe you're desperate to find a natural remedy or relief from pregnancy symptoms like morning sickness, leg and back cramps, breast tenderness, or even those swollen feet. Then Pregnancy Pukeology Podcast, Episode 20, Pregnancy Symptoms by Pregnancy Trimesters is perfect podcast for you. Want no more morning sickness, pregnancy nausea, or how about no more headaches or migraines? Visit our sponsor, nomonausea.com, the only natural way to instantly stop your worst nausea, vomiting, or headaches now. Or just place No Mo Nausea Band on your baby registry for your delivery bag at Bye Bye Baby, or get it in 2 days, ship free on Amazon Prime, or just buy it when you're buying groceries at Super Value, Shop and Stop. And note that your little ones are always taken care of with the first and only No Mo Nausea Kids now available at your local CVS and Long's Drug Store. You'll hear hilarious puke stories about pregnancy humor that may just make you want to pee your pants. Like you don't have to pee all the time anyway, with crazy stories like facial flush, barista serving up that barf, or tell all on the table. If you want to learn more about your pregnancy, humor and knowledge is the key to help you survive these 9 months. And just know we're in this together. Today, you will learn the science behind the categorical changes that pregnant women go through in each of the 3 trimesters. From why you get the wolf-like smelling, the pain in your pelvis, even when everything is okay, and the bladder of a peanut. Most importantly, I'll help you relieve the 7 most common and uncomfortable pregnancy symptoms naturally.
The science of puke, pukeology.
All good things come in 3s. That's why there's 3 trimesters. Okay, no, for real, it's because of the fact that your 40 weeks, when you look at it as an entirety, is divided into 3 separate sections. The first trimester is from conception to the end of week 12. Again, there are 12 weeks inside of your first trimester. Categorized by changes that usually are associated with the most extreme changes that you will have. People say they hate the first trimester, but again, there's some beauty in it. This is when organogenesis is happening. Your baby is growing. Literally, the organs are forming. And this is creating the child that you will end up giving birth to or deliver. So it is a beautiful thing, but it's associated with lots of hormonal experiences. Some will experience nausea and vomiting. The age-old morning sickness. Spoiler alert. I totally have the best helpful morning sickness remedy. It's phenomenal, called No Mo Nausea. I know we shouted them out at the beginning, but I'm serious. It combines acupressure with essential oil, and it really helps to instantly stop moms from puking. It's perfect. Other women will get crazy cravings during their first trimester. Mine personally was pickles, popcorn, and mustard, all over both of them. Oh yeah. If you ever found me at any of the amusement parks, you will see that I have a popcorn in one hand, pickle in the other, and I loved mustard. Well, what my body was trying to tell me is that I was craving high potassium foods and salty foods because I was getting bad, terrible cramps. My foot cramps would actually wake me up in the dead of night, and they were so painful that my poor husband was trying to work them out, but he just couldn't. And it's because of the fact that my body was stealing all of those nutrients, the potassium, the sodium, things like that, and it was transferring them and utilizing them for the baby. So I was very deficient in them, hence why my diet went skyrocket when it came to those high potassium type items. Just to let you guys know, potassium inside of mustard is even higher, like quadruple that in which you get the potassium from a banana. So on high school football fields, for example, have you ever noticed the trainers keep mustard on the sidelines? It's because mustard has a ton of potassium and it can help to break up those leg cramps instantly. Remember, when anything's put inside of your mouth, it goes underneath of your tongue, and it's considered what's called a first pass because of the fact that it goes through to your body system without passing the liver first. So you get the majority of the nutrients that you need. Those beautiful babies are stealing everything from you. Aw, isn't that nice? So it's not just your nutrients, but it's also your electrolytes. It's super important to drink lots of water to avoid dehydration during pregnancy. Anytime that you are outside, or if you're pregnant in the summer months, going to amusement parks, walking a lot, especially if you have a job like I do, when it comes to the hospital, walking around all the time, you can get very hydrated. So please make sure that you keep a bottle. They now have those really cool color changing water bottles that can actually tell you when it's been too many minutes that you haven't had something to drink. Aversions to food, and aversions meaning you are just disgusted by something that you used to love, and or you love something that you've hated your whole life. These aversions are very prevalent during the first trimester, and it's because of your heightened sense of smell. Even if food was an item that you basically loved before, you may form these aversions because your body doesn't need that nutrients, or it's craving something that you're not usually giving yourself. I want to give you an example. I basically became a vegetarian during my first pregnancy. I hated the way meat smelled. I couldn't fathom, or I couldn't get myself to eat them. And this uncontrollable feeling that I was having, it grossed me out. It actually gave me worse morning sickness. So I learned that I loved beans, and I loved a lot of other things that had high iron contents that I wasn't getting from meats. But I do have to say that I found after about my 6th week, I was able to eat some chicken. And that was only during lunch hours, because in the morning time, just high meat, high rich in protein just wasn't something that would sit very well with me. I needed a carbohydrate, something that your body can break down much quicker so that you don't give up your cookies. Now, I did suffer from uncontrollable feelings of exhaustion, and it hit me super hard in the first trimester. Ladies, this happens. Remember, we're making a human. What's your superpower? So we are literally super women, and we are creating a human being. So there are a lot of caloric intake that your body needs in order to fulfill you creating, or you having another organ source. Remember that 20% of your blood supply goes to the baby first. And again, that supplies it nutrients-wise through the actual placenta itself. Think of how many calories you expend while you walk around. Now multiply that hundreds of times by making little organs. So understand that you're feeling tired for a reason. I don't feel like I got the typical first trimester mood swings, but that would be more of a question for my husband, which I'm sure he would agree with the statistics that many women in their first trimester get it. My body, in your body too, remember, they're dumping tons of hormones from overproduction. While each of these hormones do a little bit of something different, if you're really curious on each of the different hormones that your body naturally makes an abundance of during the first trimester, I actually did a podcast on it already. It was Pregnancy Pukeology Podcast episode 13, Early Symptoms of Pregnancy. So you can press pause now, go over there, take a listen to it, because I don't want to necessarily repeat myself, but there's a lot of interesting hormones and hormonal reasons why you're puking your guts out. Second trimester, the golden period. It's like the Goldilocks, right? It's perfect. It's week 13 through 26. I've never felt sexier a day in my life than when I was in my second trimester. You're not too big, you're not too small, your boobs are nice and full, and you're just right, is kind of what I always say. This was my favorite trimester because I got to feel my little Karate Kid kicking, and it felt like a little flutter. I used to confuse this for gas the first time, and you're not really sure what exactly that flutter is. You could be confusing it for other things like, oh no, I'm just constipated, or whatever that may be. And you'll start finding out when they tend to move more or less around the day. I know that both of my children loved it when I still went to dance class. And after dance class, they were just going crazy. And then they would fall asleep about 45 minutes later. So I found that doing an 8 o'clock dance class was perfect for me and my little ones because it would actually put them to sleep because they've gotten that physical exhaustion out. Now, it's interesting that they do start developing their little personalities inside of there even before they come out. So I always say just listen to your body, listen to your baby, because they will let you know what they like, what they don't like, and when they're most active. I know that my shirt would move like crazy with my son. He was literally a little karate kid, especially during lunch hour. So right after he was, getting something to eat, he was hungry, and then he would kind of take a nap. So again, figure out what your baby likes and what your baby does also. The only thing that I didn't really like about the second trimester was around my 13th week, I started getting round ligament pain. And the round ligament is actually on both sides, and it's at your hips, or think of your pelvis if you were to put your fingers inside of your pelvis. It actually originates from the uterine horn, so from the base of the actual uterus itself, and then exiting at the pelvis. So my body was trying to make room for my little one, and my hips were moving outward with a hormone called relaxin. When you do that, you actually are stretching the ligament far past where it's supposed to go. And how does your body signal that? Pain. So remember that just because you're feeling a pelvis type pain, you're okay. That's normal. Your hips are shifting outward so that you can give birth to that beautiful baby. My morning sickness had actually stopped, but if you're not that lucky of a mama and you're still puking your guts out, I'm so sorry. You are a part of that 20% of women that will have nausea all day, all night, and all the 3 trimesters. I hate that they call it morning sickness. I think that was a termed by men, because it really should be termed all day sickness. And again, hyperemesis gravidarum, which I did another podcast on, you have to remember that is severe morning sickness in pregnancy, so bad so that you're hospitalized, you have to have IVs, and I do feel so sorry for those women. But the good news is they do have the no more nausea band, and luckily we've actually found that when you increase ketone urea, it's showing that your body is not breaking down protein as much, so that it actually is working. So try acupressure if you are suffering with hyperemesis. And you'll probably end up being prescribed other medications too, to be honest with you. The second trimester is also well known for headaches and migraines. Make sure that you stay extremely well hydrated, drink lots of water like we talked about in the first segment. And this was such a big topic that I actually had to dedicate an entire podcast to it. It's called Second Trimester Headaches and Migraines. Check out that episode 8, How to Cure a Migraine. And if you are one of those women who get terrible second trimester head pain, that's definitely what you want to listen to, because it gives you a bunch of different natural remedies that you can try, especially because remember, ladies, Tylenol is your only friend. Don't take aspirin, ibuprofen, Aleve, all of those, because they will thin out your blood, and that's not what you want, especially when your body is naturally going to be losing 500 to a liter of blood during childbirth. So please make sure that you stay away from any of what we call NSAIDs, non-steroidal anti-inflammatories. Now, my boobs didn't start getting full until about my 3rd trimester, and you may start getting increased sensitivity in your 2nd. So welcome to the 3rd trimester. You'll get nice big porn star boobs. The 3rd trimester is from week 27 to the end of pregnancy. Notice how I said the end of pregnancy and not 40 weeks, because every pregnancy is different. Some babies will get their eviction notice early, like I did, and some will want to bake in there forever and stay in there until 41 weeks. Again, what is recommended is that you deliver by 40 weeks, so some of you might actually get scheduled for an induction at your 40th week mark. Again, baking too early or too late is considered unsafe, and there are reasons for that. 37 weeks is considered full term. That is when I delivered both of mine. With one, I had a complication. With the other, I didn't know that I had complications until the actual emergency C-section and the way that it ended up pursuing. So again, every pregnancy is going to be different. Your baby is getting super strong by this point and might even kick the crap out of you. I say that because I've actually seen patients who have had their ribs broken by their babies from the inside. I can't imagine how much pain that is. The good news is that there are things called blocks where they can place local anesthetics to help decrease the pain with an infusion catheter. So you don't have to worry about all of that excess medication or a lot of pain medication going to the baby. Now there's other things that can be done inside of your body, which has a decreased amount of medication given to the baby. And again, those are called local anesthetic blocks. So remember that these patients that I talked about that got their ribs broken, they clearly needed more calcium in their diet, but they still have little Bruce Lee babies, so you can get a chuckle at that. But again, make sure that you are having high calcium diet. Because these babies are so heavy, your body is running out of room. It is very common that the babies will sit on your bladder in the third trimester, and this will cause you to have to pee every couple of minutes. But if you ever wondered why you peed the same amount, like a ton in your first trimester as you did in your third, there is hormonal changes that were happening. So go visit episode 12, Frequent Urination in Pregnancy podcast that I already talked about. It gives you the science behind why women have to pee all the darn time in all of the different trimesters. So on the same line as extra fluid, your body is actually naturally producing 500 to about a liter more of blood. And that's to compensate for the potential blood loss at delivery. Yes, the minimum amount that I've ever really seen upon a natural delivery is 250 to 300. And again, the most I've seen is liters and liters of blood that can be lost. So your body is naturally upscaling the amount of blood that it produces, and you can help yourself out by drinking lots of water. Remember, this extra fluid will cause the uncomfortable cankles that some of you will actually see. That's when gravity is pulling the hardest. And where does it pull hardest? At your feet. So make sure that you have your blood pressure checked. If you are having these massive cankles and or pitting edema, which means if you were to put your fingers on your shin and you go to feel the bone, if when you relieve your finger, you notice that the imprint of your finger is still there, that's what we call pitting edema. And you do have to worry about severe high blood pressure in pregnancy. And this can lead, obviously, this can be preeclampsia, and then this can lead to eclampsia, which is when such high, horrible blood pressure that you start seizing. The only remedy, take baby out. So again, make sure that you talk to your OBs and that you're getting your blood pressure checked on a regular basis to make sure that you're avoiding this. Now, we talk about your nipples getting darker during the third trimester. They start to get engorged with milk. And remember, they could potentially start leaking. If you're one of those moms, I envy you. I wish that mine were just fully, I wish I was Betsy the cow during my third trimester, but I wasn't. It did take the baby to be able to suck out that colostrum, or that very nutrients-rich I would say oil-based that comes from your nipples first. Remember that your baby is getting what it needs, even though it's really hard for you to actually be able to measure it. Some of you will get your very own super soakers. Yay! And with those dark nipples, they really do look like super soakers. It's so that your baby can find your nipples whenever, because remember, they see more of like a black and white. Red is then the third color that they start to see. So that's why a lot of people will paint the nurseries black, white, and red, because that's what their babies can actually see at the very beginning. If you use your super soakers, you can get your man's attention when you want it and literally squirt him from across the room. I have seen that as well. And remember, you don't just get one squirt pump, okay? It's not like it comes out of the middle. You have milk ducts all around your nipples. So when you squeeze it, it's kind of, I wouldn't call it a super soaker, much less like a water sprinkle system. You literally spray milk everywhere. And it will definitely get your husband's attention if you are spraying him with your boobs.
Throwing up on a Tuesday? One puke story.
The worst part about barfing in a bathroom at the airport is the automatic toilets. So automatic toilets continuously flush, and it was flushing in my face. So I had a mixture of poop and poopy flush in my face. And the worst part is I peed my pants because I was gagging so hard and I was heaving so terribly bad that I literally was getting water spouted from below and above. My bag was already checked though, so I had no clean pants and I had to sit in my pee pants, and all I could do was wash my face from the continuous flush in the worst bathroom. Thank you so much for that awesome puke story. I travel all the time, and so I cannot even imagine traveling while pregnant. With my first, I was still working downtown and taking the bus to work. Turns out the bus makes me sick, and it still does. One day I got off 2 stops early because I knew I was going to hurl. So I ran into the coffee shop and I hurried and asked for the key to the bathroom. And the snotty little barista told me that I would have to wait in line on my turn and then buy something. I begged her. She resisted. Finally, she gave me the key. I ran to the bathroom, but didn't make it and ended up hurling all over the bathroom door. I bought a mint tea and apologetically tipped $20, which was huge money for me back then. I have never gone back to that coffee shop ever again. Thank you, Sarah T. from Seattle, Washington. That makes me giggle. The only thing that would make me think more is if it was wintertime, because again, when you have loads and loads of big jackets, I can't even imagine trying to clean that up. Thanks for your hilarious story. We took my sister and her husband out to lunch to tell them the big news that I was pregnant. But I didn't get a chance to make the announcement because I threw up all over the table while everyone was eating lunch without giving anyone warning. I've never been more embarrassed, and my sister came up and hugged me and said, "Congratulations, I know you're pregnant." Thank you, Erin A. From Edina, Minnesota. Do you have a hilarious puke story that you just can't wait to share, or share it with all of my listeners? Send it to me. Pukeology@nomonausea.com. Again, that's PUKEOLOGY @nomonausea.com. NOMONAUSEA.com. Or just tweet us at Pukeology so we can all have a great laugh together.
Tips and tricks to stop the chuckle that you need.
So now that we've talked about why you get all of these wonderful, I say wonderful, and I'm being completely sarcastic, all these crappy things during the trimesters, but you do get a beautiful baby at the end of it. So it is work so well done. But now I'm going to give you those tips, the things of how to stop all of this crap from happening naturally, or at least avoid it from getting super bad. So number 1 is, how do I stop leg cramps during pregnancy? Number 1, buy a good prenatal vitamin. I'm going to say it one more time. Buy a good prenatal vitamin. I actually created an entire podcast on prenatal vitamins and what they each should have because it was such a highly discussed topic. Make sure your vitamin has high concentrations of magnesium and calcium. Listen to that episode 3, like we were talking about, why take prenatal vitamins, to see all of the benefits of getting a proper nutritional supplement. Again, please make sure that it has a stool softener, or at least that it helps you to use the restroom. We didn't talk about that as much, constipation, but it is definitely something that you will experience throughout your pregnancy. And if you have a C-section, make sure that they're giving you a stool softener in the hospital, because you will not be able to poop because they've just filleted your muscles, FYI. Number 2, walk or exercise daily. Make sure that you stretch your muscles and whenever that they are nice and hot. This will help to avoid leg cramps and will also help to increase the amount of blood flow that you get going back and forth from your feet all the way back up to your head. And And don't be so ladylike. Ladies, wear pants. Yes, go buy pregnancy pants and uncross your legs. It will help your blood flow. That's also the reason why they say whenever you're at the doctor's office, please don't cross your legs while you're having your blood pressure taken, because it can give you a falsely high reading. Remember, crossing your legs thus basically brings your knees closer to your head, and it will increase and shoot up your blood pressure. So you don't want to do that, especially if you have preeclampsia. Does pregnancy burn calories? Yes! Yay, it does. A sedentary pregnant woman needs about 1,800, that's 1,800 calories per day. Most doctors will tell you to eat at least 300 extra calories while you're pregnant daily. That's a yogurt and a piece of fruit. So remember, ladies, you're not eating for two. Don't double everything. You only really need something nutritious. That's 300 calories more per day. And again, the perfect amount of weight gain is going to be different for everyone, but it usually is within that 25 to 35 pound range. How to stop morning sickness? Well, natural is always best. Foods like ginger, lemons, the pectin of apples, it's actually very helpful. Have you ever gone on a cruise ship and seen that they have these beautiful green apples that are sitting there? Well, the pectin of the apples are actually shown to help decrease motion sickness, and they also help for pregnancy morning sickness as well. Me personally, I did not want to put anything in my mouth whenever I was sick. So because anytime that you do put in anything in your mouth, whether that's gum or even water, for example, your stomach actually increases the amount of stomach acids. And I know that pregnancy is usually associated with a little bit of acid reflux. So I personally, I used to keep Tums next to my nightstand to make sure that I would be able to pop a Tums whenever my acid reflux was higher, especially when I was laying down. Try to sit yourself up whenever, like 2 pillows or so. It'll help to give you better oxygen during your sleep, but even more importantly, it keeps those stomach acids down. Try acupressure. At the wrist, there's a point called the P6 point. It's located 3-finger distance above your first wrist crease and in between your first 2 tendons. And again, you can move your pointer and your middle finger tendon, and you can actually feel it. So you apply pressure for 5 minutes at a time, and get some peppermint oil. Again, remember that acupressure works in about 45 minutes to increase your body's natural anti-nausea hormones, helping you to not be sick and not get morning sickness by placing the band on the night before. P6 acupressure point has been equivalent to the effects of Zofran. Zofran was the most commonly prescribed morning sickness medication a few years ago, which has been linked, unfortunately, to birth defects and heart problems in children of mothers who were medicated during their pregnancy. So be careful. Always try natural remedies first, because it could have negative side effects and birth defects on the baby. Peppermint oil is a perfect example of how, when it's smelled, using that aromatherapy actually helps to stop vomiting in an immediate way. Guess where's the fastest way to your brain? It's through your nose. Each technique is about 50% effective at reducing morning sickness. And now Nomonajaband has made it even easier by combining these 2, acupressure and essential oil of peppermint oil, into a stylish waterproof wristband that's clinically proven to stop 80% of your worst pregnancy upset stomach. So hurry on over to nomonaja.com and buy one today. Well, how about to stop that round ligament pain? Number 1, before you cough or sneeze, bend at the hips. This will avoid pulling on the ligament with any type of rapid movements. So anticipate before you're about to stretch or pull it. Yoga. Yoga keeps your core muscles strong and helps you to stretch these muscles in a controlled fashion. Notice how I said controlled fashion. When everything is nice and warm, you're able to stretch a little farther past your limits, and it allows you to safely be able to control your muscles. Use a heating pad or some Tylenol if you have to. Try sitting in a hot bath, not too hot. Remember, we're really not supposed to be inside of spas or jacuzzis, I should say, because the temperature. Keep it under 100. And again, using some heated up washcloths works really well. So put some inside of the microwave, like after you've wet it, and then put it at the bend of your hips. Again, notice that I said Tylenol, Advil, or ibuprofen are those NSAIDs that we talked about before. High inflammatory or anti-inflammatory drugs can actually cause miscarriages during early pregnancy. And late pregnancy, it's been associated with fetal abnormalities. This will also decrease your platelet functioning, so it won't allow you to coagulate or to bring those blood vessels, I guess you could say, together so that you don't have a risk of bleeding out during the actual delivery of the baby. So how do you get ready for breastfeeding? Well, my Peruvian aunt gave me the best advice. While you take a shower, literally grab a washcloth and scrub your nipples. I know they're sensitive, but it's nothing like a little small human mouth sucking, biting, and playing with them. So get them ready now. So again, squeeze your boobs in the shower. Again, it's not just great for getting that colostrum out, which is that super yellowish thick stuff leaking from your boobs that's full of nutrients during the first 3 days of life that your baby has. But remember that pulling and sucking motion and really squeezing it out will also help you if you ever get mastitis. Ouch. I've had it twice. Mastitis is when your milk duct gets clogged. Again, the milk isn't flowing and it gets infected when it basically pools there. So your boob will turn bright red, and trust me, you will know that you are having mastitis because it's painful. But how do you relieve it? Have that baby suck that thing right on out, and or you literally milk yourself in the shower. Why are you peeing all the time? Bladder training exercises include Kegel muscle workouts. So let's try it together. Just squeeze your vagina together, or squeeze that muscle whenever you would try to pee, and then relax it and squeeze it and relax it. Your husband will also love you for this because you'll also get a little horny too. And you can't get pregnant again, so go for it. And this is those muscles. The Kegel muscles are the muscles that help you to stop you from peeing whenever you're in full stream. Remember, you have two sphincters. You can control your outer sphincter. That's the one that you can stop whenever you're peeing. But the inner sphincter, you can't necessarily control. But if you have a strong pelvic floor, it will decrease the chance of you being loosey-goosey and peeing on yourself all the time. So try to avoid drinking anything before bed, and don't have caffeinated drinks. Remember, you're only really allowed 1 cup of caffeinated beverage a day. Caffeine is a natural diuretic. So it will make you have to pee all the time, regardless if you're pregnant or not. And make sure that you get enough fiber in your diet. Avoiding constipation will help to decrease the weight and the stress on your pelvic floor so that you don't have to pee all the time anyway. So how do you decrease those swollen feet during pregnancy? Well, avoid standing or sitting for long periods of time. Sometimes you just need to get your feet up higher than your heart, and that will help to naturally, with gravity, bring that down. Try to wear those comfortable shoes, okay? And make sure that you find something that allow your feet to be mobile, allow your feet to swell a little bit. Tennis shoes are great and all, but the problem is they sometimes can have little holes through them. So again, that will be good for those breathing of your feet. And then my favorite, compression stocks or support hose. I use them every day in the hospital. It is super important. They help to pump blood back up to the brain. Think of it as a device for your feet in which in your 3rd trimesters, if you have not seen it yet, it helps to decrease those varicose veins. Varicose veins are those nasty, ugly, big, huge, thick veins. And it will help that because of the fact that it's really moving the blood instead of having it pool lower behind. So now that you guys know the science behind each of the 3 trimesters, from why our nipples get darker to why we have swollen feet, why we have to pee, and we got the answers that is the absolute best on how to help stop having morning sickness, how to make sure that you don't have any more round ligament pain, and even more importantly, how to stop those leg cramps. I want to thank you because Pregnancy Pukeology Podcast will give you the best information about pregnancy that there is up to date. If you love me, Dr. Pukenemo, and Pregnancy Pukeology Podcast, let us know. Give us that 5-star rating or hearts for likes. Don't forget to download this episode, but most importantly, share it with all your preggo friends because you know that they're wondering what's coming up next, what next trimester has to be in store, and or if you have friends that are just thinking about getting pregnant. This is the podcast, Pregnancy Pukeology Podcast, for you. Thanks again for listening, and share it with any and all of your pregnant friends because we truly are in this together.
Pukeology Podcast, edutainment at its finest.